But let me come back to this question that Sanjita Bhatia raised about convergence. If in fact the concept of convergence is accepted by many of us, we do know that there's a lot of misalignment in trying to go forward with the convergence model, right? In fact, you were at a conference we had here a couple of years ago on this whole issue. To begin with, if you look at funding, convergence across different diseases, different discipline. I'd like to have Francis think about that answer. Promotion, right? Most of universities are very discipline-driven. You talk about departments and how, in fact, people talk about career. How do you get recognized for your work, and how do you get promoted? What are the incentives bring you together? I think I would love to hear from this panel their thoughts about if convergence is the way to go. Maybe it's not the only way to go. How do we do our system all together? Francis, can I start with you?
Oh, it has to be the way to go. If you want to make progress, you want the tools, the technologies, the talents of the people who have the best chance of advancing a really bold initiative to all be there together, designing and then implementing a plan. I think about the BRAIN initiative as a good example of this. We're really going to try to understand how this most complex structure in the known universe works, those 86 billion neurons between your ears and all of the other things that support them. We would not get very far if we just brought together the usual crowd of senior neuroscientists and said, figure it out. And if you look at what's happened with that initiative now 7 years along, the last 2 or 3 cycles of new opportunities for people to come and join, the dominant discipline that has been coming on board are the engineers. And that's a good thing. In fact, that's one of the reasons we see so much remarkable progress. And again, it's been great working with CZI on this. And Cori, I think, could probably also reflect on just how critical that project has needed these kinds of convergence opportunities for different experts to come together. So I think scientifically, we have to do this. Certainly, though, our support structures, and particularly things like promotion and rewarding systems, aren't quite so quick at adjusting to the way in which science is going forward. And every academic center has their approach to this, and some have moved quickly, and some, frankly, need to move more quickly, or they're going to find themselves in a circumstance where their faculty don't get the chance to be part of some of these remarkable team efforts because they're afraid they're going to be dishonored as a result. There's no reason that should continue at this point. Our promotion and tenure processes, there's really no excuse at this point for them to be doing what they did 20 years ago.
But Francis, I think we hear from a lot of investigators when they have a new idea. It's not one of the ICs, one disease areas or whatever, right? And they say, where do we apply this to? And it's difficult to get funding when you cross disciplines. So when you go convergence, you're discussing more like a strategic approach to a scientific theme. But what about ground up, bottom up ideas? How do they get this kind of funding if, in fact, the review committees are structured around ICs?
Well, you're right about that. And NIH has its own sort of traditions that aren't necessarily well aligned with the direction that science is going. I don't know how much people have been paying attention to the revisitation of the study section organizational structure. It is massively different now than it was 10 or 15 years ago. And that has certainly caused a lot of people to get pretty upset because there were certainly some cul-de-sacs of disciplines that were not really catching up as much as they might be with new opportunities, and those basically aren't serving us well. So many more of the study sections now have the kind of convergence feel to it. And certainly a place like NIGMS sees this as part of their DNA, that they really do have to figure out ways to support this. The other thing that Elias Zerhouni came up with when he was NIH director that has been a wonderful place for these bold projects that don't fit neatly within one IC is the Common Fund. And now the Common Fund with $600 million a year, projects can come in, but they can't stay more than 10 years. Look at the output of that, and you will see some of the most exciting science that's happened in this last decade because it is interdisciplinary, it is bold, it is the kind of thing that is going to take a team. It needs to be well-designed and executed and monitored, and it needs to put its data out there for everybody to use. But it's pretty dramatic to see how that's played out.
That's right. Cori, your thoughts? probably at least in Cheng Zuckerberg, that's what you're doing in some way, right? But what do you see in private philanthropy, and then your own experience as a university researcher about this whole facilitating convergence?
So just to say a couple things. The first is that this was one of the gaps that, with the exception of something like the Brain Initiative or the Genome Institute, we did identify as something where we could make a difference. So, people weren't wrong to raise it. But I want to mention something else, which is this idea of people can't work together and we can't have multi-author papers. This is something that academics are doing to ourselves, specifically that biomedical scientists are doing to ourselves. And if you look in the fields of physics, so, when trying to explore some of these things about single-cell biology and requiring people to collaborate, we talked to people like Maria Zuber and other people Fabiola at CERN, and asked how do people in physics make it? And it's there is a structure. Everyone knows how it works. You're a junior person. You get a letter written for you by the leadership of CERN that says what you contributed to this project uniquely, even if the paper had 250 authors on it. And it's not like they write you a letter. That's part of your package that goes out to other people. The physics community respects that collaboration. And I know of institutions, I know UCSF, the chancellor sends someone to every promotion committee, and when people say oh, I don't know, second to last author, they're instructed to say, UCSF believes in collaboration. And, we can do this ourselves. We have to spend some extra time figuring out what you actually did compared to the other 249 authors. But, if what you end up finding is the Higgs boson, that's really important, even divided by 250.
Yeah.
So,
yep.
We can do this, and there are examples out there.
Alondra, in particular, when I think about a topic, something you and I work together on, emerging technology, science, there's so many other pieces that need to come together, right? As you said, social science, equity, all this stuff. How do you package all this? What do you see in this whole convergence side of things?
I see we have a big challenge facing us, but it's also tremendously exciting. I mean, as a sociologist who thinks about systems, it's clear that there are not only misalignments, but they're just kind of structural changes. Some of them are about new research institutions. Some of them are about, to Marc's point, I like to think about the different velocities at which faculty can work. So some people want to just work in a department, and some want to, as he was laying out, work across centers, and others do not. And so I think that a system that's really humming, across the S&T enterprise allows people, institutions, organizations to work at their different velocities. And that includes actually getting out of the incentive structures, dare I say it, of individual universities themselves, right, which are competing for donors and philanthropy dollars. I mean, I think the OSTP perspective here is a bit kind of 30,000 feet looking at the ecosystem, and I think with our, wonderful new leader, Arthi Prabhakar, who very much thinks from a kind of systems design perspective, what does it mean to have universities working together? The incentives, particularly around donors, are misaligned there as well. And so that is a kind of, at a macro level, a part of the systemic problem, I think, that we face as well. I would say if Ponch was here, he would want me to say, of course, NSF has been working, in a convergence accelerator space for a very long time. They've been working for a few years now. They've been working in that space in a way that hasn't transformed how NSF does its work. So I think that we can, in government, look to spaces of innovation like ARPA-H, and also to the new Technology Innovation and Partnerships Directorate that's being stood up at NIH, at NSF, that's kind of really taking seriously misaligned incentives, creating new kinds of collaborations as ways in which government is trying to think through that. And then I would say in the space of science and technology policy, there needs to be and this goes to the kind of ethics piece and the equity piece and some of the work that we were doing with CESTI, this Committee for Emerging Science, Technology, and Innovation here at the National Academies. Conversations across the ecosystem from the beginning to innovation to scale around social issues and implications. That needs to really be, I think, baked into how we increasingly think about our work. So as we're working to create a system of convergence, that part of that conversation increasingly needs to be, how do we get a society ready for that? One of the takeaways from the COVID-19 vaccine was that we didn't have time to sort of introduce it to communities, to bring them on as partners, to bring them along. And, one of the gambits that we're, doing at OSTP, which is this blueprint for an AI Bill of Rights, is sort of saying, let's slow down just a little bit, and let's bring technologists, doctors who are using automated systems, Americans who are engaging with systems and real estate and the workplace, to sort of think about how we want these to work in our life, and to begin to have a conversation before automated systems really become in toto, talk about convergence, this kind of singularity across our society. I'm half kidding here. How do we begin to have that conversation earlier on? And so I think the conversion for me is really about including in that conversation, just to sum up my slightly kind of all over the place, how do we think across institutions? How do we think across universities? How do we think upstream and the kind of innovation ecosystem? And how do we include issues of equity and trust in science and government as part of that conversation?
Yeah, absolutely correct. Holden,
Yeah, well, I think, so we see some interesting implications of this. Because, one of the things that people complain about journals like ours, if they're not complaining about the costs and how long it takes, is, how much stuff you have to get a science paper. If it's a clinical thing, you've got to have the animal data, and you've got to have the basic chemistry, and you've got to have the engineering and all these things, and you've got to cram it all in 3,000 words. Terabytes of supporting information. This convergence idea, as Alondra is saying, if you're breaking out of your field, it has the potential to make it very daunting to get all of these things done at once. And, the thing we see, and this gets to Cori's part, that we have the power to change this if we want to. The reviewers ask for all that stuff. Now, of course, we have some influence, and we should try to broker it down so that it's not quite as daunting. But as a community, we've kind of decided that if you're going to publish this big convergence paper in Science and Nature, it's got to have all this stuff in it.
Yeah.
Well, why don't we just decide you don't have to do that? It ought to be okay to say, I got this part, I got the chemistry part, I got the clinical part, I got the animal part. Whatever, I got the engineering, whatever it is, so that we're not putting this enormous burden on particularly young investigators coming up trying to do this, which then feeds into the problems with tenure and promotion and all the other things that are being discussed here. So again, that gets back to kind of what I was saying earlier, which is, and you're doing this by having this meeting, we got to get off of our own bicycle every once in a while and talk about how we can come together to solve some of these problems.
I'll come back to that for sure.
Yeah.
Marc, we talk about promotions and others. So tell me a little bit about what you're doing. How can, in fact, with the current structure, like it or not, we're still disciplined, departmental structured. How do you work on the promotions issue?
Well, maybe I can mention the promotions, but also, the incentives to get people together. I think everybody recognizes that we need a better way of rewarding, the kind of scientific activity that we want to encourage people to cross boundaries. At the same time, we do ask of our faculty to make a mark in their own disciplines. And I do think that over the years, what we've seen is more flexibility on the part of the promotions committees, and as we've encouraged interdisciplinary work generally at the university, to consider that with a more of an open mind. I think it's part of culture change that goes hand in glove with interdisciplinary work becoming more of a mainstay in the university. And so maybe I could just comment on that briefly. I mentioned how, one of the ways we've been doing this is by creating interdisciplinary institutes. To Cori's point, you then have to really work hard to make them work, to really break down the barriers. And certainly one of the ways to do that is by putting together resources that not only encourage interdisciplinary research, but are only available for interdisciplinary interactions. And let me give an example. We have an institute, one of our first interdisciplinary institutes called BioX, headed by Carla Schatz, who many of you will know, that brings together physics, engineering, medicine, biology. And they have programs where they have fellowships for graduate students, but they're only available if the graduate student has 2 mentors in 2 different schools, in engineering and in biology or medicine, for example. It turns out that there are a lot of students and faculty who are interested in taking advantage of that. And then once the connections are made between those faculty members, that they persist even after the student graduates. So we have to work on culture change within the university. We've been doing this by essentially providing a lot of carrots to encourage people to work together. And people take them up, and people do work together, and that then feeds into how people are evaluated as well. So those 2 things have to go hand in glove.
Thank you.
Can't always herd cats, but you can move their food. I think that's what he's saying.
Yes.
That's very well put, Fred.
Yeah. I do want to caution, Marc, that you have such great leadership, but also resources. Not all universities can easily do what you do. And so the real question is how we facilitate this through external mechanism as well as internal. But
Victor, if I may say, that's where foundations, philanthropy on the one hand, and NIH on the other can play the same game. They can make resources available that are only available for interdisciplinary types of studies, and I think you'll find that people will go in that direction.
I just jump in here a little bit, half wearing my former dean hat, which is just to say what I meant by the velocities thing earlier was, part of it takes resources. Our research requires resources, but to your point about lesser resourced organizations, I mean, there are ways to reimagine what it means to be a faculty member. And what I meant by velocity is that if someone is a medievalist and wants to drill down on what that is, that the university can create structures to make people, so that people are working at the height of their powers. And that looks different for different researchers. Yeah, and sometimes that will take a lot of money and fiscal resources. And sometimes it'll just take us getting out of our own way, in the space of
putting
the university.
Right people together and
people together, getting out of people's way. I mean, one of the more sort of humbling insights when I did worked on a strategic plan for social science was one of the things many of the faculty said was can we have can we have classrooms where we can move more of the desks? So I mean, I just think that what people want to do often in their research and in their teaching sometimes takes a lot of money, but sometimes it takes imagination and us being able to think about these 800-year-old institutions and how they might do the work differently.
Fair enough. Leslie, Cori, I'm thinking about what's the future of science philanthropy? In other words, what do you think it should look like if we're really going to transform, the biomedical enterprise?
I think the future is here. And it should, I would say that if I could tell you what the future should look like, then that wouldn't be the right role for philanthropy, probably. You don't want to be trapped in your own success. You don't want to keep doing exactly what you've been doing. You want to be open to the new opportunities. And, I thought about this a lot at the Chan Zuckerberg Initiative. It was an incredibly generous gift from Mark Zuckerberg and Priscilla Chan to start this philanthropy, and it represented 1% of the NIH budget. Right? It was not going to replace, we cannot as a society give up our commitment to federally funded scientific research. It is, that is going to be the heart of what happens no matter what. And so these are going to be experiments around the edges, ideas that develop where once we do figure out how to use computation and machine learning and open source software and science more, then there will be other mechanisms to fund it. It can go mainstream or whatever, but it's not a long-term. I don't think viewing it as sort of a long-term investment is necessarily the right way to think about it. That said, Howard Hughes is doing great on the basic model of the Hughes investigators, But notice that they're not just saying, well, if we have more funds now, we're just going to have more Hughes investigators. They are trying to do new things. They are doing the new experiments. And I think that's the value of these systems that,
So if you think about the drivers of science and innovation, there is government funding, there is philanthropy, and there's the private sector, right? How do we bring these pieces together to be more coordinated, more strategic?
I think that's a really great opportunity that has not been fully harvested. We've talked about ARPA-H as a new model where there may be an opportunity there to mount projects which are going to have more direct interactions between academic investigators and people in the private sector, maybe especially small businesses that have a technology that brought together with an academic idea could really go somewhere. But we also, I think, in the last 7 years or so have seen models for interactions with the private sector that have worked pretty well, but I'm not sure they're as well known about. And I'm particularly thinking of the Accelerating Medicines Partnership, AMP, which got started by a general recognition in both private and public sectors that there are some pretty fundamental questions that everybody wants answers to. Like really, what are the next generation of potential drug targets for Alzheimer's disease and diabetes that might emerge from what we're learning from genomics and single-cell biology? And it was a little tough to get people to recognize that that could be really pre-competitive, but ultimately they did. And so those projects, 7 of them now, diabetes, Alzheimer's disease, rheumatoid arthritis, Parkinson's disease, one on cancer immunotherapy, and on gene therapy for rare diseases even, the newest one of these, and on heart disease. All of these have come together in a way that brings really impressive scientists from both sectors around the same table to design the project, and they get to know each other. And sometimes they're sort of surprised. The academics like, oh, these people in the private sector, they just want to make money. And the people in the private sector, oh, these academics, they just want to publish papers. They don't care if anything really important happens. Well, both of those are wrong, and you find that out pretty quickly. And just look at that track record. This was also a circumstance where it had to be skin in the game. So the public sector contributed half the money, most of that from NIH, and the private sector contributed the other half from pharma budgets. So people had to really care about the result. This wasn't one of those things where you did a nice thing and then went off. And the leadership stayed closely connected. We could do more of that. There's lots of other situations like that. Pre-competitive opportunities where the talent is not just in one sector. Let's get it together and do those things.
I think it would be fabulous because take one area, climate change and human health and equity, right? I mean, we're now looking at trying to get NIH more funding for this area across institutes. There's private sector, but I think the kind of research is not scaled enough at this point. In fact, looking at cross-sectoral agricultural research and health and climate and others, there's not an easy place to go to when you think about these big issues. They are, in fact, still funded in different silos. Alondra, any thoughts?
No, I think that's right. I was also thinking, about the sign behind us that says the health sciences. So I was going to where you went, Victor, which, that are problems that are, not that laboratory science is not very hard and can be very thorny, but that, the complexity of problems around climate and around the health sciences and public health, I think make the convergence equation a lot harder because we are talking often about...
But very much needed.
Very much needed, like urgently needed. And I think that would be my answer to the future question. So point taken about the 250 authors and how do we get other scientific fields or physical sciences to think about that. But, how do we get, environmental scientists who do, 1 or 2, off papers or humanists and social sciences to work in that space at all. And I think around the conversation around, incentives, that is part of the challenge. And, I do think that what I'm encouraged by in this administration is that the president has a big vision for the future of the nation that says that climate change is an important priority, and mitigating and adapting to that is one that we should all be working on. And so there is a way in which there's space for all folks in the research community to sort of find a place at that table. And so I think that, and this is the part of me that's been in government for almost 2 years, I think, and thinking also about Professor Mazzucato's work, like the mission orientation matters. And I think how you align people or realign the incentives in part is with a strong vision and a kind of mission orientation for the work that allows them to get out of their own ways across silos.
Yeah, and I think, I'm sorry, just one way to connect a lot of the things that have been said. I mean, we're always focused on doing more and making it bigger. You know, you're hassling Marc about how much money Stanford has, and it's awesome that Francis got us more money for the NIH. Nobody ever did it any better. But, you know, that just made people compete more to try to get more. And the problems that we're talking about are really hard, and you can't necessarily solve them by just making your labs bigger and bigger and building more neuroscience buildings and having more postdocs. I mean, it's time to stop and think about, you know, what we really want to accomplish. And, you know, I mean, Francis had a perfectly logical scheme to try to help young investigators get more funding by taking just an ever so slight amount of money from the highly funded investigators.
Y'all remember that?
Yes. And, you know, I didn't sign the letter from WashU, but my medical school colleagues were very mad at you for doing that because I agreed with you, okay? And, you know, we can't seem to come to agreement about, you know, how we're going to distribute all this stuff. And in addition to all the equity problems that creates, it also makes it hard to solve the kind of problems that Alondra is talking about.
So I do want to ask you, all of you, the question about the future, but I want to open up the floor for, I'm sure, many questions for our speakers. But as you think about this, I'm going to ask you, let's just say 10 years from now. Now, 10 years from now, what would it look like, and what would you like it to look like if you had the ability to intervene and design it correctly for the biomedical enterprise? Right? So that's what I would like. And so, okay, let's take some questions then. Please.
Well, I wanted to follow up. Anna Greca. I'm at the Broad Institute, the Brigham, and Harvard Medical School. And for full disclosure, NIH funded, CZI funded, and an associate editor for Science Advances.
I think you're doing all right.
All my disclosures.
Your help.
I wanted to revisit this issue of the young scientists, and I especially wanted to focus us on young physician scientists. Dr. Collins had commissioned a report back in 2014 about the workforce and the dwindling numbers, and at that time we had found in that report decreased entry. We train a lot of MD PhD students, but they don't follow on to careers. We have attrition, and also the report said that there was a higher percentage of physician scientists who are over 65, 70, and so we're at high risk when they retire, that basically our pipeline will be left extremely leaky. And so the question is, if we agree that as part of our future enterprise, we need physician scientists to be a part of the teams that, you know, make all of this happen, what are our answers to this problem? And I think it also builds on, you know, what Holden is saying about, you know, all young scientists and sort of where do they get the funding to grow their own labs in this new environment.
Yeah, it's an incredibly important question, and people have been writing editorials about physician scientists as an endangered species going back at least 30 years. I wrote one of those myself, and
longer.
But it's
If
true.
you want to send us another one, we'd love to see it.
And it was bad when they started writing these editorials, and it's worse now. And you can see that trajectory, if it doesn't change somehow, is headed to zero. And even the physician scientists who are out there doing research, many of them don't have the protected time to be able to be as competitive as you would want them to, given the skills and the training they have had. As far as early stage investigators, I think a lot has been done to try to prioritize their applications to NIH. And I don't know if you've watched those numbers, but they've more than doubled. The sort of first time applicant getting an R01 was maybe 600 back in 2015, and it's now 1,300 or 1,400, by basically making that a priority. If you're a first-time investigator, you get a priority score in the top 25%, you should be funded, regardless of which institute and what their pay line currently is. Right. And I think all the ICs have pretty much decided just to do that. And that applies, of course, also to physician scientists, to MD PhDs. But we're losing them along the way, and I think that may be something that NIH has some role to play in, but it's really an indictment, I'm sorry to say, of our academic medical centers, that those same individuals are called upon to do other things, which involves potentially a lot of patient care time. And I don't know, I'm kind of old-fashioned. If you're going to be a credible physician, scientist, researcher, and you're spending less than 2/3 of your time on the research part, it's going to be really hard to be able to be up there competing with all those PhDs who are spending a lot of their time in the lab, and you're not. So our institutions have got to figure out ways to protect the time of those talented folks, or we can't blame them for deciding that this is not a credible pathway for them. And there's the financial issues, which we all know about, the terrible costs of loans that need to be repaid. A loan repayment program is getting better, but not good enough. So I'm citing all the problems that you're very familiar with, and NIH can do some things there, but I'm going to sort of call out all the academic medical centers. You got to help us here, because otherwise we do not have the workforce we need for the future, and we certainly don't have the diverse workforce we need for the future either. So big problem. Thank you for bringing it up. Come on, y'all, let's fix this.
You're supposed to up here
Fix it,
help
I
us
think.
fix it. Oh, Marc?
Maybe I can just add two things. That Francis identified many of the problems. There is the issue of on-ramp for physicians. So, MD, PhD is one route, and of course there are issues around that. But in the past, many more MDs would then go on to do research. And certainly the experience, before I came to Stanford at Rockefeller, we had a program for physicians to do research and found that only foreigners would do it. And the root of the problem was that they had no debt, whereas American MDs did. When a loan forgiveness program was introduced as part of the fellowship program, suddenly the American applicants increased. So we do, to Francis's point, have to remove the obstacles that get in the way. Many physicians would like to be able to devote themselves to research. We have to make that possible for them.
Absolutely right.
Cori?
I was just going to say the same that Marc just said, and that it's the same point that Huda made this morning. I think making it possible for physicians, particularly to have, a reasonable salary and debt forgiveness would be the equivalent of public service in getting them into science. If they're crazy enough to want to do research after doing their fellowship, we should really be supporting them.
I'd like to give you some thoughts on this issue. I wrote a paper in Lancet about redefining academic medicine. And the question is, most of us think about physician scientists in the model of Francis. Are you an MD, Cori?
Oh, no.
Okay. Francis, myself, and others who bench translate researchers and do clinical work. But in fact, if you think about where science is going also, the issue of community work, the issue of data science, there in fact is possible for physicians to do more science in the context of what they do in clinical work. So we do have to redefine what physician scientists is, if you count the numbers, and to look at how to support those individuals who are going to make a huge difference in the use of data science and others in the issue of improving equity, healthcare, etc. Some thoughts. Okay, Sam.
Sam Silverstein, Columbia University. You've given us a brilliant and optimistic view of how we can work together to accomplish what we all know needs to be done. Yet more than a third of this country is distrustful of government and distrustful of science and would not accept the idea that government is part of the solution but is part of the problem. We need some marching orders from you as a community about how we can communicate what our view of the future is and why it's the right view of the future and how we ought to get there. You've defined the problem and given us practical solutions, but they only are solutions that are enactable, as Francis pointed out, if the government, or one of you pointed out, that the government is got the funds to do the big piece of the job, because it can't come from private foundations. There just isn't enough private money to do it. So tell us, what should we all be doing? What should we all be saying? And how should you think we ought to behave in order to bring the future that you're hoping to have to
I'm going to start
fruition.
with Holden.
Yeah, well, I've written a lot of columns about this, including one pretty provocative one that dropped on Friday, and got a lot of commentary in the Wall Street Journal this morning, which whenever the Wall Street Journal editorial page drags me, I know I'm doing my job. Unfortunately, Francis and Tony got whacked this morning too.
Yeah, we got it.
So I feel bad because it's my fault. But so, you know, my whole shtick about this is we got to get a lot better at communicating with each other. Because if you look at the whole history of misinformation, you know, you can go all the way back to Galileo, but you can certainly go to the Scopes trial, tobacco, ozone, climate change, acid rain, strategic defense. There's always been some people in our community who have enabled misinformation by disagreeing with the scientific consensus without running their disagreements through the scientific process. So, and we've certainly seen a lot of this in COVID. Marc, you have a lot of these guys. I'm sorry to single you out. You know, who are, many of them are outside the field. They disagree with things, and then they tweet and have press conferences, and they go on podcasts. And, you know, it's fun to blame Tucker Carlson and Joe Rogan. But if they're quoting people from our own community, shouldn't we straighten that out first? I mean, you know, out here in the hall are pictures of people who did that too.
Yes.
And, you know, as Leslie Vossall says, it's a dude wall, so why not take a few of those down anyway? And so, if, you know, if our own people are the ones enabling the misinformation, then, I mean, I know there's not an easy solution to this, but really that's the problem before, because we've always had politicians. We had William Jennings Bryan, and we had Ronald Reagan with the strategic defense, and Edward Teller. You know, I mean, that's always been there. And so if we want people to believe what we have to say, then, you know, that's getting our own act together is job one. And then the second thing, which I think I've heard almost everybody in this panel say, and many of you as well, is, you know, we've just done a lousy job of explaining to people that science is a process, not a set of facts that fall out of the sky in a textbook, and that the disagreements that we have and the back and forth and the revisions and all of that is what we do. You know, and so if we don't explain that to people, and we always want to be the person who stands at the podium who has the answer, instead of saying, well, this is the process, then we're also giving the misinformation people a tool, because they see our back and forth and revising our estimates and all this stuff as us not knowing what we're doing, when actually that is what we're doing, and it has been for hundreds of years.
So
Victor, can I just
I'm
say-
aware that American Board of Internal Medicine is attempting to, I don't know if they're succeeding or not, that any of their members certified, right, because there's certification, that clearly post misinformation that's damaging, they can remove their membership. Now, you can imagine the reaction of members, but at least they're talking about doing this. And I do think that we have to take some ownership in making sure that, in fact, what we as a profession, whatever we say, are based on facts. And if it's not based on facts, or maybe you actually really do true disinformation, that could be actions to be taken. So
would let me just add then that would disinformation be a medical school that refuses to teach abortion, and should that medical school continue to be an accredited medical school, and should obstetricians and gynecologists who train at medical schools and hospitals that refuse to train them in abortion, should they be not allowed to be board certified?
Well, no question deserves a lot more consideration on this issue. I don't think this panel can answer your question.
254, it says there. Yeah.
Alondra? Yeah. Alondra?
Can I just add one other thing about the communication issue? I think what Holden has said is right, that we did a poor job with COVID and probably with other things, explaining that science is provisional, that you do the best you can with the data you have in front of you, and you should say at that very moment, and this could well change when we have new information, as soon as tomorrow. But we're doing the best we can with what we have in front of us. That should have been said all the time during COVID.
Exactly. We've learned that well.
And I'm guilty of that as well as others. But I do think more positively, I don't think this is going to be solved by better government communication, although it could be a lot better, and it could use social media instead of talking heads on cable news, which probably doesn't convince a whole lot of people to change their minds. We could use, certainly, more TikTok and less CNN might have been a good idea to try to get the information to the people who are still open to changing their minds. But why don't we have, this is just a thought idea, why don't we have a way of activating our entire scientific community to become part of this communication process? Leslie was talking about encourage your students in the lab to take this on and be promoters of accurate information, but do so in a formalized way. Let's form a science communication corps and ask every graduate student and every postdoc if they want to join and provide some kind of resource and support so that they have the kind of information and don't get caught completely without some kind of grounding if somebody's asking a tough question that just came out of nowhere. And not make this just, we'll hope it'll work if we send you all out there. Actually provide some kind of framework.
I think it should be part of a scientific training, right, altogether.
Oh, there you go.
We can ask, one last question.
He deserves a chance
Marc?
to say something. Yeah.
I just wanted, listening to Sam's question that started this, I wonder, though, Sam was asking, the concern was expressed of how do we maintain public support for our enterprise. And I think what was just discussed is part of it. But I do want to say something a little bit more hopeful, which is we do a lot of polling ourselves in public opinion, as does the AAU, the Association of American Universities. We see a lot of data on what drives unfavorable impressions of higher education and research universities and what drives favorable impressions. And it's important to recognize that people can have an unfavorable impression for one reason. For example, the people are concerned about the cost of universities, the cost of attendance, access, and certainly a large segment of our of society is concerned about issues of free speech on campus, for example. But it turns out that the favorables often dominate those unfavorables, even in the minds of individuals. And the biggest driver of favorable impressions of research universities, and we can extend that beyond that, is innovation, and especially innovation in the life sciences and medicine. The public at large understands that our enterprise generates life-saving therapies and cures that will have impact for them. And they may have a dislike for one or other aspect of the enterprise, but overall, the impression, the favorables override the unfavorables. And so what's important in our communications is to focus on the good that we're doing for society. I think that's job one.
Mm-hmm. Yes, I think that was emphasized in the earlier session. Elena, why don't you ask the last question?
Thank you, panel members. Wonderful presentation. I'm Elena Fuentes-Havlik from the University of California, San Francisco. I'm a pediatrician by training, and I can't help when I listen to the presentations we've had, this panel and previous panels. We talk about silos, we talk about the need for more interdisciplinary, interspecialty work, and I feel that there's an opportunity to take more of a life course approach to many of these issues, whether it's cancer, rheumatoid arthritis, Dr. Collins, you raised, the other priorities. To my ear, we talk a lot about from the adult spectrum, but we don't think about how the whole life course is as integrated. So I would suggest that one way to revolutionize the medical and health sciences might be to incorporate not only an equity lens in everything that we do, but a life course perspective as well. Thank you.
Thank you. I want to end by asking each one of you just to, one. Totally agree. This town was supposed to be transforming the future from your perspective. So maybe in 2 sentences for each. What do you see we need to do for the future, and what should it look like, say, 10 years from now? Francis?
2 sentences.
I'll give you 3.
As I started out, I think the scientific opportunities in the next decade are absolutely breathtaking. If we can do what we need to do to support the talent to come in and work in these fields, whether it's neuroscience or whether it's figuring out how to treat all of those currently untreatable conditions caused by DNA mutations and even cure them, or whether it's understanding enough about cancer that we can no longer worry when you get a stage 4 diagnosis, because we have a cure for that too. We should, in the next 10 years, be able to make accomplishments that will absolutely dwarf what we've been able to do up until now. This is the golden era.
Very optimistic. Yes, Cori?
I'm going to speak a little out of my officially assigned role here and say that what I want to see in 10 years is real progress in neurodegenerative disease and mental health based on brain science. And I think that is realistically in view. I think, when the war on cancer was declared in the 1970s, people were like, oh, the war on cancer, it ended and we lost. And then, over decades, there became like a disciplined attack and decrease in cancer mortality, basically 1% a year over like 25 years. Really impressive. And I'd like to see the same thing happening in some of these other areas and I think that's possible. I think neuroscience is 20 years behind, but it's time to start.
Oh.
Great. Alondra?
For me, 10 years, and pulling on some of the threads of the conversation, something like S&T enterprise convergence, right? Like everybody in this room, everyone on this panel has a piece of making the sort of larger enterprise better, and we're going to need everyone in this room and their different capabilities, their different sectors to make that possible. In 10 years, I want to imagine an S&T enterprise system that includes and benefits all people, and I'm talking about everything from welders to Nobel laureates, and I think that we need to begin to think about, to the life course perspective, K-12 education, to new innovative research institutions is how we think about the S&T enterprise. I want to the question about public trust. I think we need to have in a decade a space that has a lot more public accountability and like some humility and just honesty that we are often doing research and doing policy in a context of low trust. And that's like we can hark back to the halcyon days where we had high trust, or we can actually sort of make policy and lead institutions in the space that we have, which is a kind of humility around the low trust. Lastly, I want us to imagine a kind of anticipatory, thoughtful S&T policy space that is anticipating implications that might come, that is bringing the American public on board as partners in the work that we're doing, including all of the American public, wherever they sit demographically, wherever they sit in the kind of spectrum of equity across our nation.
Excellent. Thank you very much. Holden?
Yeah, I think the most important thing is that we've got to examine everything that we've been doing and be willing to think about how it plays out outside of our world and what we can change inside of our world to make a difference in that. And it's so easy, and certainly I was guilty of it when I was a young faculty member and right up until I went into administration, to just focus on the metrics that I had to achieve.
Right.
But the problem with that is that, we come to these things and we talk about a lot of big ideas, but then we go back and do what we were doing before and we don't change anything. And so I think a lot of things are possible, and I'm very optimistic about it, but only if we're willing to change some things that have seemed like they're immutable, but they're not. It's up to us.
Marc?
10 years from now, I'd like to see that we have made huge strides in this problem of access of students from all backgrounds, and particularly underrepresented backgrounds, into the medical sciences and life sciences. That we made great strides in the culture change that's necessary for us to realize the potential of the convergence of all these disciplines, where we've broken down the silos effectively, where we've also become much more skilled at rapidly applying knowledge. I still think the valley of death that we talk about is a solvable problem if we put our minds to it, and I think it's a solvable problem in the next decade. And lastly, we haven't touched about this very, very much in our particular panel, although it's been mentioned earlier in the day. I think we focused a lot on our country, but I think strengthening international bonds at a time of deglobalization and rising tensions, and making sure that we engage with the rest of the world. Human health is a universal problem. We have to work together to solve it. And I'd like to see us look back 10 years from now and say we made great strides also in strengthening connections with countries and scholars and scientists around the world.
Hear, hear. Well, thank you very much indeed. I want to thank our panelists for the really great closing thoughts. They're truly leaders in science and institution, and I think they are certainly carving a pathway forward for the next 10 years. So thank you. All right, good. Thank you. Thank you.